We are facing financial, material, and structural constraints. However, we must also face up to the reality that resources are finite everywhere, and even the richest countries today are struggling in the wake of this global pandemic. And so therefore, I'm very encouraged by what we are doing for ourselves on the continent, the pledges that were made, led by South Africa and Egypt, totaling now so far $61 million towards our own continental solidarity in the anti-COVID-19 fight, for supporting individual countries, but also supporting our own CDC. And I believe we now need to move with more speed to avail and to deploy these resources as we continue to encourage our colleagues across the continent to contribute, so that these resources can be used to mitigate the situation in a view of flattening this curve. I also want to say that we need to be able to work together and to pool whatever little resources that we have and show that we are also capable of coming together to defeat this fight, because I also believe at the end of the day, it is going to take each and every one of us, individually and collectively, to win this war, and not necessarily 100% depending on our friends from the outside world coming to support us. I want to thank our colleagues as well as the chairpersons of the RECs that have participated for all your individual and collective efforts to address this pandemic. I want to re-emphasize what has been said by my other colleagues, that our RECs are an essential vehicle for the effective monitoring and implementation of our continental response to this disease. I believe that we should do this taking cognizance of the imperative for cooperation in border management between neighboring states, and to be also honest in how we push our information, because transparency in relaying information across RECs is highly important, especially given our porous borders. So I just think that if we are to defeat this enemy, we need to really be able to ensure that through our RECs we are able to communicate, to work together, to be able to deal with cross-border issues, because unless we fight together, we will lose together. Having said that, colleagues, I must note also with concern that the infections on our continent continue to rise on a daily basis. 10 of our countries now have over 1,000 cases, compared to 6 when we met last week. And I think that it's worrying that 3 of our countries, as we've just been told, have passed the 4,000 mark since our last meeting. And many other countries, including my own, are continuing to see increased cases on a daily basis as we move forward. So we are not over the hill yet, and it is therefore important and imperative that we prioritize the flattening of the curve on our continent, and this especially more so as we expand testing on the African continent, again, as we have been told. So therefore, we have to do everything that it takes to ensure that we flatten this curve sooner rather than later.